Comprehensive biomarker testing is when we take a small amount of tumor, hopefully from a biopsy, and try to figure out if there are genetic abnormalities in that tumor that can be measured and that can be used for treatment. So there are many different abnormalities or biomarkers that we can find in patients with non-small cell lung cancer. We can find mutations or changes or damage in the DNA of the tumor. We can find molecules on the surface of lung cancer cells, and these can help us in terms of guiding the treatment for lung cancer. When we do comprehensive biomarker testing, we often find a lot of biomarkers. Some of them we can actually address, so we have drugs for multiple different biomarkers, and the actionable ones are the ones we have drugs for, the ones that we can actually change. But there are a lot of other biomarkers for which we don't yet have drugs.
So when we talk about comprehensive biomarkers, it's a little bit of a paradigm shift. We're saying right up front, when you diagnose the lung cancer and identify the need for a biomarker test, please do the panel of tests that at a minimum are currently actionable. What Dr. Gomez just told us about the tests for which you have treatment that can actually be applied to the individual patient. Think of your cancer as a lock, as a locked door, and the targeted treatments as the specific key that will open the door. But you can't just grab any old key and expect to open every door you run into. You have to make sure that the key matches the lock and will open the door. That's the role of biomarker testing. And that's why you have to challenge your doctor to make sure that he does your biomarker tests as early as possible into your care.
So there are some limitations. There are, for example, segments of the non-small cell lung cancer population that typically do not have actionable biomarkers, like, for example, patients with squamous carcinoma. Now, some patients with squamous carcinoma do have biomarkers that are actionable, but the majority do not. And so we try to test the patients where we're more likely to find a genetic alteration or a biomarker. Other limitations, unfortunately, these tests require a specific amount of tissue. And in an era where we're getting smaller and smaller biopsies for patient comfort and patient satisfaction, we sometimes run into the problem of not being able to do the testing because there isn't enough tissue in the biopsy. One other limitation is how long it takes. So these tests are complex, and they can take anywhere from 7 to 10 days in very fast laboratories to 2 to 3 weeks in slower laboratories.
It's not that your doctor is hiding stuff from you or is trying to hurt you in any way. It's just maybe the doctor doesn't know, or maybe the doctor has not prioritized it just as well. So the first thing I would say is our patients need to be armed with knowledge. They need to be empowered to ask questions of their doctors. The doctor is not a god. He's a human just like you. And he has human failings, part of which may just be he didn't know. So I think it's important for us to talk about this, ask about it. I have lung cancer. Wow. What's the best treatment? How do you know what is the best treatment? Am I a candidate for a biomarker test? What is this biomarker? How are you going to be able to tell what my best treatment option is? Is there a pill that you could treat me with? I hear there are all these wonderful pills out there. Am I a candidate for one of those? The point being, the only way the doctor will know what the best treatment for you is as an individual patient is if he does the biomarker test.